Hi everyone. Welcome to today's video. We're diving into a topic that's very close to my heart: visual impairment. When we hear the words blind or low vision, we often think of someone who simply can't see. But in reality, visual impairment covers a wide range of experiences and challenges. In this vlog, we'll explore what visual impairment really means, the different types, how it affects daily life, and the signs we should look out for. Let's start with a basic definition. Visual impairment refers to a condition where a person's eyesight can't be corrected to a normal level, even with glasses, contact lenses, medicine, or surgery. That means even with available treatments, their vision still poses challenges in daily tasks like reading, walking safely, or recognizing faces. More than just a medical diagnosis, visual impairment is also defined by how vision loss affects a person's ability to function. It's not just about how clearly someone sees, but how that vision loss impacts learning, communication, movement, and independence. There are two main types of visual impairment: total blindness and low vision. Total blindness means a person has no sight at all. Low vision means the person still has some useful sight, but it's limited, even with glasses or contact lenses. Understanding these types helps us know what kind of support or tools may be needed. When we say someone is blind, it generally means they have no functional vision. This could be complete darkness, or only the ability to sense light. People who are blind rely on other senses and often use tools like white canes or screen readers to navigate the world. Now let's talk about low vision. This is a condition where the person has significantly reduced vision, specifically 20/70 vision or worse in the better seeing eye, and this cannot be corrected with ordinary glasses. According to Scheiman and Whitaker, low vision usually results from eye diseases and requires specialized strategies and devices to manage daily life. A person with low vision might struggle with visual acuity, or the sharpness of what they see, contrast sensitivity, which makes it hard to tell objects apart when there's little color difference, or a narrow field of vision, like looking through a straw. These difficulties vary, so support must be tailored to each person's needs. Not all vision loss happens the same way. Some people are born with it. This is called congenital visual impairment. Others develop it later in life, which we call adventitious. Adventitious vision loss often requires a bigger emotional adjustment. Imagine knowing how to read or play a sport, then suddenly needing to relearn everything in a different way. That's the reality for many who lose their vision over time. Now, let's talk about some common signs of visual impairment, especially in children. Watch out for eyes that don't move together when following objects, crossed eyes, eyes that seem to bulge, shake, or move rapidly. These are signs that a child might not be seeing the world the way others do. Other signs include pupils that look white instead of black, unequal pupil size, constantly closing or covering one eye, and even an unusual level of clumsiness, especially when moving around or playing. Also, take note if a child sits too close to the TV, holds books or toys very near their face, or avoids activities that need good vision, like coloring, puzzles, or playing catch. These behaviors are often their way of coping with poor eyesight. Let's look at how different types of vision loss affect what someone sees. With central vision loss, the person struggles to see what's right in front of them. Reading, recognizing faces, or any task requiring detail becomes difficult. Colors might appear dull, and straight lines can look wavy or distorted. Peripheral vision loss is like seeing through a tunnel. The person may bump into things, miss people approaching from the side, or have trouble going up and down stairs. This type of vision loss affects mobility and safety more than fine detail. Some experience blurry vision all over. This affects how sharp and clear the world looks. They might have double vision, difficulty seeing in low light, poor contrast, especially with similar colors, and discomfort from glare. This makes reading, walking at night, or identifying objects especially challenging. Visual impairment, especially if it starts early in life, can impact many areas of development. A young child may face delays in motor skills, language, social interaction, and learning. That's why early intervention is critical to help children reach their potential. When someone has trouble seeing things far away, it affects how they learn and interact. They may struggle to imitate others, read facial expressions or gestures, coordinate what they hear with what they see. It can also make moving around independently more difficult, especially in busy or new environments. On the other hand, if near vision is limited, everyday tasks become more challenging. This includes reading and writing, grooming and hygiene, preparing food, finding or organizing belongings. It's not just about vision, it's about being able to live independently and confidently. Thank you for watching this episode on what is visual impairment. I hope this discussion has helped you gain a clearer understanding of the condition, its signs and implications, and how it affects individuals in their daily lives. If you found this content informative or meaningful, please consider liking this video. Share it with your friends, classmates, or colleagues so we can continue spreading awareness about visual impairment and disability inclusion. And don't forget to subscribe to this channel for more educational videos on visual impairment, inclusive education, and accessibility. Together, let's build a more informed and inclusive society. See you in the next episode.